All right. Well, for our audience today, we'll start off with a 5-minute introduction.
Sure.
Let these gentlemen kind of know exactly who you are,
For sure.
what you do, and then we'll get rolling.
Yeah, for sure. So my name is Dr. Michael. I'm a PT in Evanston. I started to practice Valiant Physical Therapy in July of 2022. And when I was thinking about coming today to present to you guys about private practice, every time I tried to sit down and think about what I was going to put up on the screen and what kind of presentation I was going to make, I felt like no matter how I tried to do the presentation, it was to sell you on one idea or another, whether you should or shouldn't start a practice. And I know that you guys are probably wondering that question in yourself. Is starting a practice something I want to do? Do I actually want to open a business? What is it like to have a private practice? And I felt like every time I was sitting down to create a presentation for you guys, it was to sell you on one idea or another. That's kind of what it ended up becoming. So when I was talking to Brett, I was like, I'm having a hard time figuring out what topic to talk about because I didn't want to, tip the scales, if you will. So when him and I were chatting, I figured he was really good at asking questions. So I'm like, why don't we just do a podcast style thing? And then I hope that in the question and answer, you guys get to learn a little bit about what it's like to have a private practice, and you can kind of make that decision on your own. So I'm an open book. I'm excited to be here because I love talking about business. And so here I am. Let's do it. Let's go for it.
Awesome. Yeah, so we collectively, out of the 40-something people in our group chat, were able to come up with a series of questions, and we're just going to go ahead and go one by one, and then hopefully we get through everything, we'll just get you raw, authentic answers.
Sounds good. Ready.
So the first question is, what steps did you take to gain clientele and spread word about your practice when it first started up?
Yeah, great question. So the first question that you face when you start a business is, how do you get clients, right? Obviously you have to figure out what you're selling. As physical therapists, we're selling physical therapy. So then the next question is, okay, well, how do you get clients? It's very helpful to define a niche and then to market to that niche and then become known for treating that niche. So for me, it's runners. So my first patient was a runner who had Achilles tendonitis. So as someone who can market myself as a PT for runners, when he heard, hey, my Achilles hurts, it hurts when I run, and here's this PT that works with runners, it kind of makes sense for him and for me for us to work together. Beyond that, from a marketing standpoint, it's really helpful to do events, right? So different workshops, coming out to speak to you guys is actually helpful for me in various different ways. Not from like a client acquisition standpoint, but just from building relationships in the community. So it's like, that's helpful for generating business. So things like this, getting out in public, talking about your business, meeting new people, getting in front of potential clients, that's pretty much how I built it. I haven't gotten into paid ads yet, but it is something that I'm starting to play around with.
Fantastic. Very good.
Follow up on that.
Yeah.
How useful has social media been in?
Yeah, that's a great question. The question was, how useful has social media been in gaining clientele? Mm-hmm. Well, I despise social media. So I'm not very good at like posting on Instagram, creating content in that sense. I like YouTube. I am trying to make more of a push to make some YouTube content this year. So that is something I'm trying to grow. I haven't really gained many clients from whatever social media I've tried to do. I have gotten some, but it mostly comes from referrals.
Right.
So.
Cool. Great. Awesome.
Yeah.
I know we've mentioned a couple times about getting active in the community, things like that, so have really helped the business. Second question, we'll move on, we'll proceed. So what equipment was essential for you to have to start up your practice? What were those things
That's a great question.
that you had day one?
So I'm assuming you're asking from the standpoint of like what physical equipment to like treat the patients?
Yeah, we can go. You can attack this question however you'd want, whether that's location, site. Like I know your backstory, so please, by
yeah.
any means, like where were you? What equipment did you have available for strength and conditioning side
Great.
versus the PT side? Or did you just have your goniometer? You know
Yeah,
what
great.
I mean?
Yeah, sure. So, yeah, okay. So I started my practice, and we're still operating inside of a personal training studio. So the general idea of that business that I'm operating within is the gym owner has the space. He's fitted out the space with a bunch of different equipment, and he basically allows personal trainers to come in, put their client's name in a logbook, sign some waivers, all that kind of stuff, and then they can treat their clients in the gym and use all the equipment. And you basically substitute personal trainer for physical therapist, client with patient, and okay, hey, meet me at this place at this time, and I'll treat you there. And the gym is awesome, and the guy, Derek, who owns the gym, has done a really good job of fitting it out with a bunch of stuff that's actually really helpful in this sports performance side of things. So there's a squat rack, there's a sled, there's a trap bar, there's bumper plates, there's leg extension, leg curl machines, and there's treadmills, Stairmaster, battle ropes, TRX. So it's a gym that you could go and work out in, but that's technically not the way that the gym works. You have to be one-on-one with someone. So, I didn't have any capital when I started my practice. I literally just filed the business paperwork, which is like less than $300 online, and just started seeing people. And I brought my laptop to the gym to treat this guy with Achilles tendonitis. And there was a communal massage table that was in the gym. And I literally just knelt next to the massage table with my laptop on the table. It was so sketchy. And it was totally, I look back on that, I'm like, wow, I can't believe someone paid me for that. But that was a really cool moment, actually, because in some ways, I kind of broke the seal and said, okay, I did my first cash PT sale. And then from there, it's just kind of okay, how do I make that better? How do I make it better? How do I make it better? What else do I need? What else improves the client experience? So as far as what equipment I had, I basically had access to a personal training studio and a laptop.
Sure.
That's basically it.
Sure.
So,
and that's all you really need. Can you explain the breakdown as far as revenue percentage between starting in a gym versus any other option? What did that look like for you off the bat?
Yeah. So I didn't necessarily have any other options, if that makes sense.
Sure.
So what I did to find that gym was I Googled gyms near me, and it just populated a bunch of different dots on the map, and I called each one of them. And I said, hey, I'm a PT looking to start a private practice. I'm looking for some space to treat patients. Do you have an extra room? Do you have the space for me to come in? And I just kind of went through this entire list that I had, called all these different places. And once I landed on where I'm currently at, the guy was like, yeah, well, this is how it works. It's a personal training studio, so you could just bring your clients here and train them or treat them, whatever you want to call it. And I charge my own rate, and then he charges me a rate per hour for seeing somebody. So it actually worked out really well at the beginning, because it's not like I was I was never paying a fixed rent. So it was kind of, I pay when I use the space.
Yeah.
So it kept my overhead extremely low.
Sure.
So I was basically as busy as I could make myself, and it didn't, I didn't need to pay some rent amount. So it's not like I had to build up a bunch of cash reserves to commit to a lease and then grow the business from there. So it was very much as I could do it.
Sure.
So it worked out well.
Was this all happening while you were practicing elsewhere? Was this a side?
Great question. The question was I doing this while also practicing somewhere else? And I neglected to mention in my intro, I should have fleshed out my journey a little bit more, but I graduated from PT school in 2020, in May of 2020, and then I got a full-time PT job working for Advocate Healthcare out of school, and then I worked there for a year and a half until I decided to start my practice, and then I shifted to part-time working for Advocate, and then I was trying to build up my own caseload on the side. So I didn't go from working full-time to burning the ships, is what they call it in online, is hey, I have no option but to succeed, right? So you burn the ships behind you, and then you have to figure it out. But that is just, I don't know, it's too risky. And isn't necessary. So I told my boss, hey, I want to open up a cash-based private PT practice, and I want to switch to part-time. And then she's like, okay, what hours do you want to work? And I was like, these, Monday, Tuesday, Friday. And then I treated patients for my own practice Tuesday, Thursday, and then sometimes Saturdays at the beginning. So, cool. Yeah. Any other questions on that?
No, thank you
No?
for answering that.
Yeah. So it was like, hey, this is when I'm available. Come see me during these times. And I would only pay when I had people. So it was very easy. It was very fertile soil, and it was very easy for me to just grow it without really a lot of strain.
That's good to hear.
Yeah. It worked out actually very well.
And you speak about building that caseload. With those initial patients, I think in a perception-wise for us as PT students, starting that private practice, there's a lot of resistance that may come up.
Sure.
As far as like, okay, I get one patient through the door, how do I get the next 5? For you, what did that look like? Was it referrals? Was it marketing? Was it, and kind of walk through that initial
Like how to
patient,
get more people past the first one?
the initial patient workflow.
So again, with the specialty being runners, okay, so when you start a practice and you're defining a niche, you'll quickly figure out this idea of like, okay, well, what is my client avatar? Like who is the ideal client that I'm trying to reach, okay? If I'm a PT that specializes in working with runners, it is not the grandma that just got her knee replaced, okay? So no, she needs PT. She can go wherever she wants, but the person that I'm trying to communicate to and trying to market towards is the runner that has pain, right? So when you think about who is the person that you're trying to attract to the business, you then have to ask, okay, where are they? Where do those people congregate? So in Evanston, there's a Evanston Running Club. It's one of my favorite clubs. I'm an active member of the Evanston Running Club. So I started going to the running club.
Yeah.
Hey, who are you? What do you do? Hey, I'm a PT that specializes in working with runners. Oh my God, I have some knee pain. Can I see you?
Yeah.
And then it's like that person, I start seeing that person, and then the next person, and the next person. And now at this point, I'm very grateful and thankful to say that I have a network of patients that are within the Evanston Running Club.
Yep.
That now at this point, it's like anybody that has pain with running and is talking about it in the running club, there's like multiple nodes of people that are pointing patients in my direction. So at this point, it's not just like, oh, I heard your name from Bob. It's like, I heard your name from Bob, Nick, Nancy, Joe.
Sure.
And they're all telling me about Valiant PT. So having that niche and having that avatar and understanding, okay, where are those people congregating, and then going there and then telling them this is what I do, that's all marketing.
Yeah, for sure. And I guess this essentially answers the following question. There was one of our students that asked, do you rely more on direct access or referrals? And that would answer.
It's all direct access.
Okay.
Yeah,
yes.
It's all direct access. So obviously in PT, you're from a different state, aren't you? You're not from
I'm
Illinois?
from California.
You're from California, yeah. Are you guys all from Illinois?
I'm from PA.
Oh, you guys are from different states, huh? That's awesome. Yeah, Northwestern kind of brings you guys all together.
Yeah.
But yeah, so Illinois has direct access. Every state is a little bit different. Some states, I'm not going to try to pretend like I know any of the direct access laws in other states.
Yeah.
But in Illinois, it's basically like, it's like pure direct access. Like I don't need a physician's referral to treat someone unless their insurance asks for it. And now I'm at the point, if I didn't make this clear, was I started out the private practice cash-based, and then as it grew, I realized that the reimbursement rate from Blue Cross Blue Shield PPO is like basically spot on to what my cash rate is. Not exactly, but the way the math works out, it's close enough. So I went in network with Blue Cross in 2024, maybe December of 2024 or December 2023. I can't remember. And then that has been great, and that's been a good addition. So all that to say, sometimes I'll get people who have Blue Cross Blue Shield PPO, were in Illinois, a direct access state, but their specific insurance plan requires prior authorization. And you guys are going to learn all this when you get out in the clinic. It's sometimes there's some more like insurance-based hoops to jump through.
Yeah.
And it's just a matter of like figuring that out and doing what needs to be done. Question?
Did you ever take on, going back to your patients, did you ever take on patients that were outside of your niche at the start out of necessity?
For sure. Yeah. At the beginning, it's whoever wants to work with me, I'll work with them. Right. You're just trying to build your caseload. You're just trying to get some reps in. So yeah, I absolutely treated some people who weren't runners, didn't have a running related issue, had no aspirations to run, but they happened to cross my path one way or another, and I was not about to say no. At this point, I am saying no. If they're not the right fit, it's like, hey, I think you should go somewhere else. So,
On that point, how long did it take you to get to that point?
it's a good question. Well, I'd say I was trying to say no pretty early on. Obviously not right at the beginning, but there is a point where, so the standard flow, and I think you'll find this true for a lot of private practices, is you schedule a discovery call with somebody from the practice who then talks to you about working with them, and then they get you on the schedule. So that's the process that we have. So if you go to valiantphysicaltherapy.com, you'll see buttons all over the place that say schedule free discovery call. You click that button, it goes to a call schedule calendar. That's my call calendar. And then you would schedule a call with me. I get on the phone with the prospective patient and I talk to them about what their issue is, make sure that they're a good fit, and kind of just onboard them through that. So there are times where I'm on the phone with someone and I'm like, yeah, it sounds like you need to go somewhere else. And it is actually pretty important to do that and to say, hey, you should go somewhere else, because it kind of protects the purity of your marketing and kind of like what the business is about. So I didn't actually answer your question as to when I started to do that, but that's just kind of something I've always tried to do. If I'm on the phone with someone that I know is like I said, if it's a grandmother with a knee replacement, probably not going to be a good fit here. We don't have a new step, right?
Yeah.
We don't have a new step at the clinic, so at the
sure.
gym, I should say. So
For sure.
that's important for them.
Yeah, no, definitely understand where you're going from.
Yeah.
Why did you choose the models? Walk me through like the thought process of, you started cash-based. Obviously you realize the advantage of accepting and getting more direct access. Why choose that model over just going straight insurance and accepting all insurance? Or why choose
Great
that
question.
model over just sticking it out with cash?
It's a great question. So the hybrid model, which is what it's technically called, is okay, I'm taking Blue Cross Blue Shield PPO, but no other insurances. Everything else is cash-based. So there are people paying cash for physical therapy in the clinic, and then there's also people who are paying with their insurance. So the all cash model creates obvious problems when it comes to the point of like, okay, actually converting a lead into a paying patient, because they have to pay out of pocket. So that can be challenging. It's not an insurmountable challenge, but having the business only based on that is there's a lot of peaks and valleys as far as the revenue. The Blue Cross Blue Shield kind of stabilizes the revenue actually in a pretty real way. So, and the payment is good, the reimbursement rate is good, and it allows, and this is getting to the actual point of your question, is what are the different advantages of the different models. Having the hybrid model, I have felt, allows me to keep the quality of care good, and allows me to keep the quality of care, the care one-on-one with somebody.
Value.
So if you go to big box PT clinics, and I don't know if you guys have any experience working in them, but at least observing in them, you'll see a physical therapist juggling 2 to 4 people within an hour, sometimes even 5, okay? And the reason that happens is because the reimbursement rate for insurance can sometimes be so low that in order for the clinic to be profitable, they have to be billing 4 people at the same time, right? So they're not treating 4 patients at the same time because it creates better outcomes. It's because it actually allows the clinic to survive, right? So one of the big things with private practice is that it is a business. It is literally a business. So you don't want your business to lose money. You need the business to make money for it to survive. The business doesn't have to only be about making money. That's a whole nother topic. The philosophy of like, why do you get into business shouldn't necessarily be to make money. But in order for it to live, it has to make money. It is like blood, right?
Yep.
The cash needs to move in the business and it needs to grow over time. Otherwise, it slowly dies. So how do you get the business to grow? Well, you could just do way more volume, right? And if the reimbursement rate for those sessions is low, well, now let me double it up so that the hour that the clinic can generate the revenue that the clinic can generate per hour is higher, but the quality of care suffers. So there is a fine line between, okay, cash pay is all one-on-one all the time. Accepting multiple insurances creates a situation where your hourly revenue is low unless you're like doubling up on people or tripling up. And I feel like the hybrid model where you're doing cash and Blue Cross Blue Shield PPO in particular, which has a really good reimbursement rate, is a nice blend that allows some patients to work with you really easily because you're a network, but it doesn't create a situation where the reimbursement rate's so low that you need to like start seeing 3 people at the same time. So it's always going to be one-on-one because of the reimbursement rate from Blue Cross. Does that kind of make sense?
Yeah.
So
Definitely.
if I wanted to like totally juice up the clinic and get 1,000 patients in, I would start going in network with all these other insurances. But then I would be getting back like $70 or less for a patient, where it's currently like closer to $150.
Yeah.
So it's like, all right, well now I should probably see 2 patients at the same time, so that I can level that whole thing out.
Yeah.
So for the most part, are you only seeing, like in your practice now, are you trying to only see 1 patient like per hour?
Yeah, it's always one-on-one. Yeah, so it's one hour per patient, and people like that, and people really like that. Okay, the patients enjoy that because they don't get that everywhere, and especially if they've gone to a place, they've been passed around, and then it's like, okay, well, you're telling me that I get to spend one-on-one for an hour with a doctor of physical therapy and somebody who actually knows what they're talking about, and somebody that specializes in working in the sport that I'm trying to work for. Okay, well, how much is that worth to them, right? So, a few $100.
Yeah, no, definitely. My next question, just to follow up a little bit off script, is like, give me a little sales process on this discovery call,
Yeah.
right? I pick
Yeah,
up the
great
phone
question.
and this is my first time going to PT. Why should I go to you versus
For sure.
versus the big box PT? And like, literally, let's pick up the phone
Yeah,
and
yeah,
let's
pick
go.
up the phone.
Why is a 1 hour with you better
Yeah.
than being one of 5 at XYZ company down the street?
Yeah, fair enough. So I love your question. I'm going to change it a little bit because I like the idea of framing it like, hey, we're on the phone for a discovery call.
Sure.
So I'll kind of talk a little bit about like what that process is actually like.
Yeah.
And just kind of go through like what the script essentially is from my perspective and like how the conversation usually goes for the discovery call. So like I said, you go to the website, schedule a discovery call. Okay, now you're on my call calendar. I call them at the time of their that they schedule.
Choosing, yeah.
Right? And I basically break the ice, talk a little bit about something that doesn't matter just to get the conversation going. And then I always love to figure out where my referrals are coming from. So I then ask them, how did you hear about the practice? Okay. And that gives me a pulse as far as like what marketing stuff is working and what relationships are really strong.
Yep.
So there's a handful of people that will send me like 5, 6 people in a year, whereas some people are only sending me one person a year. So, okay, the person that's sending me that many more referrals per year is a good relationship that I need to continue to foster. And
Very true.
I'll foster them all, but
Yeah.
figuring out where my referrals are coming from is important, and I ask that in the call. So once I basically break the ice, talk about where the referrals are coming from, let me back up a second. What I typically do is I frame the call, and I said, okay, what we're going to do during the call is we'll take the next 15 to 20 minutes. I'm going to ask you a few questions about your situation just to make sure that we're a good fit to work together. Not everyone is a good fit to work with us in our practice, and if it sounds like you'd be in better hands with somebody else, I'll do my best to refer you off to that person. But if it sounds like we would be a good fit to work together, I'll talk to you about what working with us looks like, and then I'll get you on the schedule.
Okay.
So I kind of frame that, and then we kind of get into the conversation. So I ask them, hey, what's up? What hurts? Your knee hurts? When does it hurt? I basically do a subjective over the phone. And there's often times where I'll be talking to someone, I'm like, you don't need to see me. You need to go get an MRI. You need to go see a physician. You need to go get an X-ray. Like, think about Ottawa ankle rules, Ottawa knee rules, or foot rules, I should say.
Sure.
So, so I basically do a subjective over the phone with somebody, and if it sounds like they would be a good fit, I tell them that. It sounds like you'd be a good fit, blah, 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 blah. And then I talk to them about, okay, well, I think we should start, transition the conversation to getting you on the schedule. So, payment, what is payment like? What insurance do you have? I'll ask them. And if they say Blue Cross Blue Shield PPO, I say, great, that's the one and only insurance that we're in network with. And then if they're not in network with Blue Cross, if they don't have Blue Cross, they'll say, great, then you apply for our out-of-network discounts. And I talk to them about the different treatment plans that we have and the discounts if you buy in bulk and all that kind of stuff. So I don't know if I'm answering your question. I'm just kind of rambling. But the general idea is over the phone, you can have a really one-to-one, heart-to-heart conversation with someone and just kind of like listen to their problem and then explain to them how you can help them. This is let me actually get to the answer to your question. So something that's very helpful to do, and this is just like a sales principle in general, is all business is solving problems. It's just solving people's problems. I'm sure you guys have heard that before. So if you can show people where they're at, where they want to be, and how you are going to build the bridge for them to connect those 2 points, that makes a lot of sense for them, and they say, yeah, let's do that, okay? So what does that mean? Okay, hey, I'm having knee pain with running, and I have a half marathon scheduled at the end of May, like it hurts really bad, I can't really run right now, like what's going on? Okay, well, we're PTs that specialize in working with runners. Have you ever had your running gait analyzed? No. Okay, well maybe there's something in the way that you're running that's contributing to that problem. So are you doing any exercises that are helpful for the knee? No, I can't really figure it out. Okay, well what we can do is we can do an evaluation of your knee, do a running gait analysis, figure out, okay, what problems are there with your running gait? Is that contributing at all to your knee pain? Let's get you some exercises to start making the knee feel better just in general. And then over the course of the next few weeks, we'll build you back a return to run program, and then we can help you complete that half marathon.
Sure.
You know what I mean? So what problem do they have? Knee pain with running. What's their goal? Racing the half marathon. Here's how we're going to help you with that process. And then that usually paints a nice picture for people.
Yeah, for sure. Definitely. Yeah. That was a good response.
Thanks.
When it comes to payment plans, what does that look like for you? Like 8 weeks, a month, 2 months, 3 months?
So the way we have it right now is a 15, a 10, and a 6-visit treatment package. So they buy in bulk a set number of sessions, and then the more that they buy, the less the hourly rate is per session. Sometimes what we'll do for patients is we'll split up that bulk payment into 2, but it is better if we just get the money up front. So if they need to, then we can kind of talk to them about the payment plan, but oftentimes I'll just say, this is what it is up front.
Has your hourly rate increased since you started?
For sure. Over time. Yeah, it should.
It should. Start, if you don't mind me asking.
Yeah, so I could tell you what the pricing structure is. So I started at $180 per session as like the intro, like, hey, this is how much it costs to work with me for an hour. And then I can't exactly remember what the tiers were for, I believe I had a 6-visit, an 8-visit, and a 10-visit package. Or maybe I had a 6, 8, 12. I can't exactly remember what it was when I started, but I want to say that the lowest was like 140. Then it went 150, then 160 per session, other way around. So the lowest number of sessions, I think, was 6. And it was 160 per session, and then 8. I can't exactly remember what it was at the beginning, but there's some sort of a ladder.
Here, this is yours now.
This is mine now. So the way it is there's the PT sessions, and then there's the coaching. This is kind of a whole nother concept, but for the PT sessions, it's 6 visits for 14, which is an hourly rate of $169 an hour. 10 visit is $159 per hour, and then 15 is $149 per hour. And these are actually a little bit low. But the reason that I'm keeping these low for the time being is because my overhead's pretty low, and the space that I have I feel like doesn't really warrant it to being any more expensive. I'm looking into moving locations, and when I do that, then I will increase prices slightly. Yeah, chances are pretty high that happens. Because I read something recently that you shouldn't just increase prices just because. Like you kind of have to say, hey, we're increasing prices because we're adding this, or we have too many patients, so we need to kind of tamper that, or something like that. So I thought I was going to do a price increase in Q1, but as I thought about it more, it just felt like greedy, you know?
Sure.
So.
Right on.
Yeah.
Well, a reason would do good for your clientele. Like,
for sure.
Giving them, like, oh, okay, it makes sense why this price is going up.
Exactly. And rather than inflation. Right. Yeah, so hey, we moved to a new space, prices are going up, and then, yeah.
Definitely. Switch gears a little bit on you. There is a specific question asking about having a specialty or board certification, or anything specific to focus on runners.
Sure.
Personally, I don't know if there's anything out there that says you're certified in runners.
Right.
But you know, like getting a sports certification. What was that process for you? You didn't obviously do residency. Did you feel like you needed to do something like that? And has it or has it not hurt the business in any way?
Sure. At the beginning, I thought maybe I should do a sports residency. But then you look into actually doing a sports residency, and it becomes like that is your job. It's not, you can't do a sports residency, as far as I know, when I looked into it, it's not like you can do a sports residency as like a weekend and evening, like, hey, I'll study and I'll do it, and then I can also do some other stuff on the side. It's like you are doing the sports residency, like that is like your number one focus. So that was out right away because I'm like, well, I can't focus 100% of my attention on the sports residency because I'm trying to build the business. So what other ways can I improve my skill set in this? That's essentially the question. What are the ways that I can improve my skill set in treating the patients that I'm trying to treat? And there is no, like, you know, cat's out of the bag on this one. There is no running specialty thing where someone gives you a certificate and says, now you are specialized in treating runners. It's like, okay, I took some continuing education courses on how to treat runners, and I continue to do that, and I'm constantly like looking at, you know, what are some really good ways to treat sports injuries. I'm just building my personal knowledge of that. It doesn't come with any certificates. So like my name still is Dr. Michael Cortese, PT, DPT. That's it. I don't have any other letters after that. And I don't care about getting more letters. I don't think that there's any that I would particularly need because it's not like anybody's asking me. Maybe you asked me. You guys are asking me, right?
This is a question,
and that's what it is. So this is the first time I've been asked that question in 5 years. So it's okay, is what I'm trying to say. Not that it doesn't matter, but I don't think the market needs to see that.
And exactly. Yeah. I think the most important person that needs to even worry about that question is the customer.
Sure.
And if they're not even asking you about that, then it's not worth the time, money, and the yearly investment.
Yeah, exactly. So the the idea of like, hey, I specialize in working with runners. Well, what does that actually mean? Well, I've taken running related CEUs. I've taken sports related CEUs. I'm a runner myself. I know what it means to do all these different races. I've done Ironman, I've done marathons. So when I'm talking to these patients about the races that they're doing, I have that rapport with them. And I've essentially built my life, literally built my life around treating injured runners through physical therapy. So I don't know when I'm going to be granted a specialty certificate, but I'll tell you, I think I have a good idea of what's going on here.
Yeah.
So
awesome.
I don't know, you know.
That's awesome. That's awesome. Yeah, I completely agree. Any questions there? Oh, good.
Rolling.
Talk a little bit about work-life balance. I think
that's awesome.
A perception about starting your own business, period, is it's night and day. No weekends off versus working at 9 to 5. You have your specific hours, and once you're clocked off, you're clocked off. But as you and I have talked about, when you have your own business, you never really clock out. So talk to us about that.
Yeah, so that's probably one of the sneakiest surprises about opening up your practice is that it is a business. And it sounds kind of stupid to say it, but I at least was very naive about what I was even doing when I started. I'd really, like, the idea of starting a PT private practice is like kind of cool, right? It's a cool idea, and it's a really good option for people, and it can be done. But I think a lot of people don't really appreciate that it is literally a business. So do you actually want to start a business, and what does that actually entail? And what it entails, from what I can tell, is total commitment to growing it. It is not a side hustle at this point. It started as a side hustle, but it had every intention of replacing my full-time job. So that I didn't start it as something that was always going to be this like side thing, because even when it's a side thing, those are arguably the hardest times, because it takes just as much mental focus, and especially at the beginning, it takes a lot of mental energy to get it off the ground. And if you're also working part-time somewhere, thinking about the business, then you're on a day where you're in the clinic, in your own clinic, and you're thinking about growing the business. Then you go back to work for someone else, and you're thinking, holy shit, I got to do all this other stuff for the business. So the thing with the business is that it commands your utmost commitment and attention, and it never leaves you. You can always be doing something for the business, and that is a problem that a lot of business owners, myself included, have, where it's like, hey, it's Sunday night, we're kind of like getting ready to watch a movie, and I'm thinking about, it would be really awesome if I could sneak away for like 2 hours and just like get some computer work done before Monday rolls around, because as soon as Monday rolls around, I'm in meetings, I'm treating patients, I'm going to Northwestern to give a presentation. Like there's things going on all the time. So it is not in any way a, hey, you clock in, you clock out, these are the hours that I work, and this is it. It is 24/7. So then to build off that, when people talk about starting a business, they talk about the freedom that you gain by being able to control your schedule. And that is true in the sense that, like, I can say to myself during, this block of time, I'm going to go to Northwestern, I'm going to give a presentation to the PT students. Or during this block of time, I'm going to go get coffee with someone in my network, and I'm treating patients during these hours, and I only need to go in during those times. However, you don't really have full control over your schedule, because you're answering to the business. You're answering to the clients. There's calls and there's meetings, there's things happening all the time. And you don't actually gain any time freedom outside of, how do I explain this? It's like I was saying before, the business commands 100% of your focus and attention. So the way your day is structured is different, and it's different than being an employee, but you have to think about it all the time. So you're not actually free. In some ways, you're less free by being the person that's in charge of operating the business, instead of just being someone that's treating the patients.
When it comes to something you can compare to your part-time job to your business, treatment times, do they look the same? Is it still 8 to 5? Is it earlier in the morning?
Great, that's a great question. So his question is, how do treatment times differ between running your own business and being employed somewhere? So I'm going to tell a little story about this, and please help me if I stray away from the question too much. But one of the things when I was working full-time for Advocate was I had a really great schedule. I really liked the way my schedule was, and I actually really enjoyed working there, if I'm being honest. And there was one point where my boss was saying, hey, we are going to change the hours of the clinic. So now what your hours are going to be is you're going to work late on Mondays, you're going to work early on Tuesdays, and then you're going to work late on Wednesdays, and then early on Thursday again. And I remember thinking to myself, no way, I do not want to do those hours. That is not what I want to do. I wrote an email back. I said this would be bad for the clinic. I kind of blah, 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 made some I made my point, right? So they didn't change it, so I got to keep my hours. Little side note, once I left, I figured out that they did change those hours in the clinic. So I was the one that said, no, don't do it. I was like, no, don't do it. And then when I left, they changed it. So whatever. But that was a really intense. I had really hated that idea that somebody else was going to tell me, hey, this is how your life is right now. We're going to shift the hours of the clinic, so that means you're going to have to work late, turn around, come in early the next day. Okay, I hated that. Now what I'm doing is I'm starting at 6, working till 8. So it's like my schedule right now is shittier than what was proposed to be a change that I was like really passionately against. So now I'm like working till 8 and then I start at 6. And it's not because I can't do it another way. It's just because that actually works really well for the business. And because I'm the owner of the business, I'm like really passionate about seeing it succeed. So I'm like, okay, let's do what I got to do. You know what I mean? So, did I answer the question?
Yeah.
So
you start treatment times earlier than normal.
Yeah, earlier than normal.
Later.
Yeah, and so let me actually explain that a little bit further. So my schedule is that way, but at 6 a.m. on Wednesday and Friday is a group exercise class that I do for male runners in the winter. So it's very seasonal that I'm doing this right now. My normal hours actually begin at 1 p.m. and I'll go till 8, or I'll start at 10:30 and I'll go till like 5. So those are like my actual hours. However, the reality of being the business owner creates opportunities and situations where I have to work really late, wake up really early the next day, and just do it that way over and over and over again because that's what the business demands. But my treatment hours are pretty cushy, you know. I would kill for those treatment hours and be an employee somewhere where I didn't have to worry about patient acquisition, sales, and, you know, cash flow. So.
And that's a good point. I want to touch up on that question is you're CFO, CEO,
Yeah.
you know, you're marketing, you're head of sales right now. Longevity of your business, how do you approach developing a team?
Yeah, great question.
And hiring.
Great question.
And what does that look like for you? So then that way you don't have to be a 6 to 8 as you progress in your 5-year plan, 10-year plan. You're then coming and hopping in the clinic. Hopefully there's more clinics. How do you approach that?
Yeah, so just to clarify your question, you're asking like how do I plan to grow the team?
Sure.
Is that,
and then the team you already have now.
Yeah. So I'm a big fan of Andy Frisella, as you know. And Andy Frisella, he's a podcaster. If you guys haven't heard of Real AF, have you guys heard of Real AF? Yeah. Really great podcast. And he's a CEO of a supplement company. And he often talks about like culture and leadership and, you know, talent and stuff like that. And he always says that it's important that when you're starting and growing a business that you have to build the business so big that the employee that you hire sees an ability for them to move up within your business. So we all start the PT private practice because we're interested in like, hey, being more free, having more flexibility with your time, but really what you then kind of get caught into is owning a job, which is another way to think about it. If you're the only one that is working and you get hit by a bus or you go on vacation, the clinic stops. Nothing is turning if you're not working it. So you don't actually own a business, you own a job. That's something you'll hear often. So to then, I like to say, pass the hit by a bus test, I want to get the clinic to the point where I don't have to be operating it for patients to get treated and for the business to grow. So what does it actually mean to build a business that operates without you that grows is you have to build it to a position where the people that are inside the business see growth potential for themselves within the business. So it's not just that I have to build a clinic that I don't have to work and is on autopilot. I also have come to the realization that I have to build multiple clinics so that anybody that's inside the clinic can see themselves being the clinic manager at a specific clinic. And then maybe they can go up into some higher position where they're looking over all 3, right? So there has to be some upward mobility for the physical therapist, which is oftentimes, I don't want to say missing, but not actually that good in the corporate structure. I could tell a story about that. But I think to answer your question, the idea of what I'm trying to do is actually now I'm trying to build really good PT jobs.
Yeah.
One-on-one care, working with athletes, flexible schedules, like, okay, we're working with a good patient population, pay is good, and blah, 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 all that kind of stuff. And then there's upwards mobility within the company, right? So I'm trying to paint that mission and that vision for the people that are working for me now.
Gotcha.
Like, hey, we're going to have multiple clinics. And then there's going to be clinic manager positions that come later.
Yeah, definitely.
Let me tell a real quick story about one of the things that actually pushed me into doing private practice was
Go for it.
when I was working for Advocate, I actually really liked the job. It was a really good PT job. I was paid well, the hours were good, the patient population was good, I liked my commute. I actually liked my coworkers. I didn't like my boss too much, but I think that's most people. Most people don't like their boss for one reason or another. And I remember a point in time when I was kind of sitting in the back room typing notes with my colleagues, and I looked to my left, I looked to my right, and I said, "You've been here for 25 years, you've been here for 15 years, like these people are just planning to retire here." And I thought to myself, I'm like, I don't see myself retiring at this place, like next to these people. Like, I want to grow my career. I want to do something bigger than just be a PT. So then I thought to myself, okay, well, what options do I have within this company? Well, I could have my boss's job. That's like the next level up. And you'll find this when you guys start working as PTs, it's like, okay, you'll graduate with a PT degree, start working as a PT, and then that's basically the job. Everything else after that is moving up into like middle management for different companies and being a clinic manager in some capacity, whether that be corporate or even private practice, like I was mentioning before. But a supervisor position opened up, and when I had a one-on-one with my boss, let me take a step back. I remember looking at my boss and thinking to myself, I would never want her job, because she's basically just being told from people above her what to do and say, and it's like, she used to be a physical therapist, she moved up into that management position, and then it's like, did you forget what it's like to work as a PT? You're kind of making life kind of awful for everyone right now.
Yeah.
It's like it's not that enjoyable, right?
Yeah.
It's like progressively getting worse, the job. So I remember thinking, okay, well, I would never want her job, and I don't really want to be retiring here with my coworkers. So like, I feel like I got to do something else. And then a position opened up for a supervisor role, which was technically underneath my boss, but above being a PT. And then she said, well, the idea with the supervisor role is that once I retire, supervisors would then progress into being the manager of multiple clinics like I am. And I'm like, in my head, I'm thinking, okay, so the supervisor role leads me to your job. Okay, I'm out.
Yeah.
I don't want to do that.
Yeah.
So a mixture of things kind of made me realize, like, all right, you know what? I think I just need to start my own practice, because that's the only way that I could see myself improving my career. But if I'm being totally honest, I didn't really consider other options very seriously. I kind of like thought about private practice. I was like, okay, I'm going to do it. And sometimes I wonder, what if I looked harder and I found another clinic that actually had growth potential and was actually like maybe another private practice that needed a PT to do something in the health field. But and maybe would it have been better if I was a manager at some other company, not necessarily the company I was at. So I didn't really think too hard about what my options were. I just felt, I think I should start my practice now. And that's kind of ultimately what I did, and here we are. So I hope that you guys followed me through that story.
Fantastic.
I know I rambled a lot.
That was a great story.
Thanks.
That was good.
Yeah.
I didn't know that, so that was great.
Yeah.
No,
Yeah.
it's fine.
Yeah. No, it's okay. I think the last question I have, and just
Yeah.
keep it quick just
Sure.
because of time.
Yeah. Seems like it.
What can student physical therapists be doing to better set themselves up for the business aspect of private practice and just being a private practice PT?
That's a great question. So I would encourage you guys to really think about, if you want to start a private practice, like, why do you want to do that? And then also learn as much as you can about what it actually entails to operate a business. Because like I said at the beginning, the idea of PT private practice is kind of cool these days, and it is cool, and I love what I do. I'm very happy that I started my practice. I also think I kind of got lucky, because I think I have what it takes to do what's necessary to grow the business, right? And there's a few people that were in my PT school that started their own practices that they were like, hey, I can't do this. So they decided to dissolve it. And I think it just comes from lack of knowledge of actually knowing like what does it take to start a business and to grow it. So if you, besides trying to be the best clinician that you can, like in being the best at treating patients that you can, that's important. But if you really are thinking about starting a practice, start thinking about what it would be like to start a business. Don't even worry about the physical therapy side of things. Like what would it actually be like to start a business? And then start to think, okay, well, do I want to connect those two pieces of like me being a physical therapist and starting a business? Because if I'm being honest, if you're really like just trying to make a lot of money, probably just get into real estate or something. Like there's a lot more lucrative ways to go than like PT private practice, if I was being honest. But
Sure.
so think about what it would actually entail to start a business and to grow that.
Great.
Yeah.
Awesome. Thank you. Do you have any
Cool.
more questions, guys? No?
Cool. Well,
Awesome.
thanks for letting me jabber.
Thank you for your time. Thank you for your time. We appreciate you coming out and sharing everything.
Yeah, absolutely. Thanks, Brett.
Yeah, thank you.
Thanks, man. Cool.
Right on.